You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with sleep apnea. Also, what can be done for people that are loud snorers and can't seem to do anything about it. Well, with us, we have an expert on this topic of sleep apnea. We've had her on the program before, Dr. Meghna Dassani. Dr. Dassani, welcome to the program.
Well, thank you. It's good to be back.
Now, so for people that don't know your practice, because you do a lot of things in your practice, but who's the typical patient that's coming in for a sleep apnea treatment?
So there's a variety of patients that we see. It could just be somebody that snores, and those are the ones that usually the wife is bringing the husband in, dragging them by the coattails because she's tired of not being able to sleep. It's the bed partner that's bringing them in. The other patient that comes in is someone that knows they've been diagnosed with sleep apnea. They've been prescribed that CPAP. They're just not able to use it for whatever reason. They hate the noises, the hoses, the mask, they can't sleep with it, whatever the reason may be. And those are the ones that know they need the help, they just cannot use what they have.
So CPAPs work.
They
right?
do, absolutely. They are the gold standard. However, there's so many folks that are unable to tolerate it, and for that reason, it stays under the bed.
Now, you said like 60% of the people that have a CPAP machine that is effective don't use it.
They don't, and it's such a sad thing for those patients to come in and tell me, because these are the ones that are falling asleep while they're talking to me. You know, they're
really?
Here.
Is that bad?
Oh my gosh. They're here that for the reason that they need the help. And while we're having this discussion, they're the ones nodding off. Ones that we're doing treatment on, they've decided to go ahead with the appliance, which is an alternative, an option for that condition that they have. And we have assistants going, open, you're biting me, open, you're biting me. And we know they need help. They're the ones, do I want them on the road? No, I need them to be awake and rested and aware of their surroundings instead of trying to fight that sleep. Those are the guys we see.
Okay, so these are people, this whole sleep apnea crowd or chronic snorer crowd, that during the day they're breathing just fine.
Oh, yes.
But at night when they lay down, now they can't breathe. So what, the jaw's dropping back? What's happening?
Yes.
And what are you doing to fix it?
So when we all fall asleep, our body relaxes, you know, you're laying down, your tongue falls back, and that closes up your airway. When that happens, your body isn't getting the oxygen it needs. Your heart slows down because that oxygen isn't getting to where it needs to. And the brain goes, wake up, because I'm not getting the oxygen. And what happens? Then your heart has to speed up because it has to get that oxygen to the brain. And this just leads to enlarged hearts. We see patients that come in with higher heart rates. They have palpitations. They wake up like they don't know what's happening, in a panic, and it's just your heart compensating for the lack of oxygen. And what can we do about this? It's as simple as a custom oral appliance.
That just kind of pulls it out a little bit?
That's it, literally. It's fit to your jaw, your teeth, based on what we need to achieve to gently move that jaw forward. And what does that do? It moves your tongue out of the way, it opens up that airway, so you're able to breathe. How simple is that?
Now, we're talking in the green room. You say that the appliances today are a lot more comfortable.
They are, yes. You know, back in the past, and I've been making these appliances for years now, they used to be bulky because for whatever reason, the design was such. And the newest ones, and I actually just had one made for me. I do not have sleep apnea, but I like to see what I'm prescribing to my patients, so I can give them an honest opinion as to, yes, it truly does feel like this. And they're so light. You can barely tell you have anything in there. Super bendy, you're not trying to contort your mouth open, get that in, and super comfortable, really easy.
Are there a lot of people wearing CPAPs where you are?
There are a lot of people that have CPAPs, that have been prescribed the CPAPs.
Okay.
I don't know if they're all wearing them.
Like thousands where you are? Like within an hour of your practice, thousands of people that have this problem?
Oh, more than that.
Oh, really?
Definitely.
So it's a big thing.
Yes. The most common one, and I think a lot of folks know about, is Reggie White.
Okay.
And he had sleep apnea the night that he had his fatal episode. From what I've heard, the CPAP was under his bed. What a tragedy, right? How many of these people do we know? Most commonly is, oh, so-and-so passed in their sleep. Most of those cases are from complications of sleep apnea. Can we prevent that? Of course.
Now, you say that these people have to adjust their lives. It means they're so loud when they sleep that they don't even sleep in the same bedroom.
That's right. That's right. Too many of these stories. And I joke with the wives, we got to get your husband back into the bedroom. Best story that just happened actually last week is we had this wife that had called crying because, she was so worried. Her husband snored, which of course was an inconvenience. But what worried her more was that he was choking and gasping. She noted him stopping breathing. And that's not very fun to watch. We made him the appliance, everything works great. We had a new sleep study, he's getting the oxygen he needs. And she comes in last week and she's still crying. I'm like, oh my goodness, what's up with you? Well, now she can't sleep because now she can't hear him snoring. It's like, you never know what.
She's so used to the noise.
Yes. And she's like, I wake up making sure he is breathing and he is awake. Well, yes, now he's rested, but she still isn't. So they get used to that. It becomes part of their lifestyle. And just knowing that we're able to do this for these people is just so gratifying. There's so many people we can help.
So these people think they're sleeping, like 8-9 hours in the bed, but they're not sleeping. What does that mean? I mean, they think they're sleeping.
They're waking up, yes. And it may not be a wake up, I'm awake, I'm going to go get a drink of water. But because their body is not getting the oxygen, they're stopping breathing X number of times, 40, 50 times an hour.
Oh, so you measure that. So you know how many times they're...
Absolutely. And that is what determines how severe or not the sleep apnea is. And what happens when we're not sleeping, when our body is not resting, there is no healing going on with the different stages of sleep that our body needs. You either are healing mentally, what I call your brain is replenishing all of the neurotransmitters that it needs.
Okay.
Your cortisol levels don't go down the way they need to. You're always tired. You're always stressed out. That's when you wake up in a bad mood. You don't know why. You're just grumpy.
Yeah.
And most people blame it on, I need a gallon of coffee to wake up. No, you don't. You actually need to be able to sleep because your body isn't healing.
So I think we all know what it's like to wake up. If we didn't sleep that night, whether it was a flight all night or whatever, you feel terrible, you're hungrier the next day. Is this what they say, that the sleep apnea crowd feels that way? They feel lousy all the time?
Yes. And what do you find yourself reaching for when you haven't had a good night's sleep? Be it your late night flight or more commonly, I just didn't get quality sleep.
I'm reaching for a lot of coffee or bad food.
Yes.
For some reason.
The carbs, the unhealthy foods, right?
Yeah.
And because we want that instant jolt of energy. When you're not sleeping, your hormones that regulate your hunger, the hormone that tells your body I'm full and I don't need any more, doesn't get replenished. The hormone that tells you you're hungry is out of whack. So what are you reaching? You just want food. Give me more food, even though you're not hungry. And that's just your brain.
When you get these people sleeping again, do they lose weight?
Oh, yes.
Oh, really? Okay.
They're motivated to work out. They're motivated to eat healthier. What more do you want? You want a healthy patient. You don't have the physical healing going on, what I call sending your body into the body shop. Your muscles are not as sore the next morning. We could talk about this all day and I wouldn't be done. Can you tell how much it matters to me that my patients are healthy and are sleeping well? There is an easy fix. If they have a CPAP that they're not using or are snoring or are just not sleeping well, it needs to be addressed.
Now, medical insurance covers this in some cases?
It does. What I have found typically is that if medical insurance helps pay for a CPAP, they do help pay for the appliance.
So you're set up for that in your practice,
Absolutely.
like medical billing?
Yes, absolutely. We'll bill medical for our patients. We'll make sure we get the best benefits for them. At the end of the day, it's all about helping our patients. So we've figured out what we can do to help them get the benefits that they need.
What defines? Give us a working definition of sleep apnea. How does somebody know if they have it? Or maybe a spouse is watching this. What does it look like, sound like? And I guess what's
most commonly is the snoring, the noise that the bed partner is aware of. They know they're snoring. In most cases, they're choking, gasping for breath. I've had one wife come in and tell me her husband turns blue, and that scared her. That's what motivated her to bring him into the practice. But what is sleep apnea? And a lot of people don't know that. Sleep apnea is when you're stopping breathing for 10 seconds or more, X number of nights a night. Usually it's 15, 20, 40 times a night.
10 seconds to go without breathing?
Yes. Can you imagine that?
You can measure that? You measure that?
Yes. There's two ways to measure that. One is you go to a sleep lab, you have a sleep study there, you spend the night there, and they hook you up to electrodes, I guess, to measure that. And if they notice it's to a point where they're concerned about your sleep apnea, they hook you up to a CPAP typically, and that gives us the readings. Another option is for folks that do not want to do that. It's just inconvenient, and I tell folks it's like sleeping in a hotel room. I don't always sleep well in a hotel room because I need my pillow, I need the temperature a certain way. You're just used to your own bed, and which is why we have the option of a sleep study.
So an at-home
Yes.
sleep study.
And it gives us the exact same results that we need. It tells me your level of oxygen. It tells me if you're stopping breathing. It measures if you are snoring, how loud you're snoring. It gives us all of that data that we need. And then we have a sleep MD read it. We have a diagnosis, and then we can move ahead.
So a medical doctor looks at the report.
Absolutely.
Gets with you.
Yes.
And what's like somebody that's bad? How many, is it measured by how many times they're waking up?
So it's
hour?
given a number. It's given a number that classifies it as mild, moderate, or severe. So anything above 40 is severe. I want to say the most severe I've treated was a 168.
What does that mean, something like that?
It's just how many times they're not breathing or how many seconds they're stopping breathing during the night. The appliances are FDA approved for mild to moderate sleep apnea. Does it mean we don't treat patients with this severe? I tell every single patient that walks in through the door, if you're not using the CPAP, this is next best. And I'll take whatever little more oxygen you can get with this appliance in your mouth, as opposed to that CPAP being a cat toy or in your garage or under the
You
bed.
say that you see transformations. That means you put somebody on your protocol with the
Yes.
appliance,
Yes.
get them sleeping again, and their life changes.
It does.
How so?
They walk with a spring in their step. When they come in, they're all rested and they've been working out. I see folks that have lost weight. There's one person I didn't recognize him because he was all buff and been working out, and like, what have you done? The cutest story, and I say cute because it's an 82-year-old man. His name is Bernie, and he came in saying he needed to take his honey for an anniversary trip to Paris, but she'd had it with his snoring, and she refused to go on the trip if he didn't fix it. And he's like, I need this appliance tomorrow because we're leaving. I said, well, we can't do it tomorrow, but we can make sure you have it by the time you go on your trip. And sure enough, you know, we made him his appliance. It worked well. He went on his trip. So when he came back, we had a bottle of wine from France. We had pictures of them at the Eiffel Tower, and his life has changed.
Now, you know, look, I know when I sleep, that you wake up the next day, you're more optimistic.
Yes.
You're excited. It's like you want to do more things. You want to plan trips and things like that. Is that the way it is with some of these people?
Yes. They just find they're more productive. There's more quality time they're able to give to their families because they're just not grumpy and tired. They're able to go out, play soccer with their kids, spend time with their significant others. It's just a whole different person.
You helped a loved one. Somebody in your family, is that right?
Yes, we've lost a family member due to complications related to sleep apnea. And that is something I never want to have anybody else go through if I can make that happen. So a very close family member did get tested for sleep apnea, does have an appliance.
And it works?
Yes.
Did you see a change in this person?
Absolutely, absolutely, yes. It does
Now, there's
work.
technique to this, that the appliance doesn't do all the work. That you've got to go to a qualified doctor, dentist,
Yes.
that has a lot of
There is
training.
specific training that goes into this. It's not just something.
So there's a lot of adjusting that goes involved?
There can be what I call titration. When we make the appliance, it has to be titrated to your bite, to your jaw, once you're fitted with it. So it's a process. It's not you come in, we make it for you, hand it to you, and you're on your own. No. There's a protocol, there's a process that needs to be followed, and which is why you do need advanced training for
Are
this.
women also, they get sleep apnea, or is it mostly men?
Oh yes, no. I know, your overweight older male is the typical patient that everybody describes, but, and this breaks my heart. One of my team members, her 7-year-old, we just diagnosed her with sleep apnea. And you just know that child isn't sleeping, gets in trouble all the time, right?
That's cool.
Yeah.
Okay.
Or even at home, just getting in trouble for fighting with your siblings or whatever. And she has sleep apnea.
So they're not sleeping? The kids aren't sleeping?
They're not.
We're going to take a quick break. We come back, more about the process, what people can expect. You're watching the Wellness Hour. I'm Randy Alvarez. We'll be right back.
I was first diagnosed with sleep apnea probably 12 or 13 years ago, and at that time I was prescribed a CPAP. I could not do it. I couldn't tolerate it at all, so I went for years suffering from this. So I saw Dr. Dassani, was fitted with an appliance. It's been a month now, and my life has totally changed. I'm sleeping. My wife says I'm quiet as a mouse. My blood pressure's down. That makes my exercise during the day easier. I don't have that brain fog that I was having because of lack of sleep. As I said, the high blood pressure. So the benefits have been tremendous. It's changed my life, and I wish I'd have done it a long time ago.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering either chronic snorers or sleep apnea. And with us, we have an expert on the topic, Dr. Meghna Dassani. So let's talk about snoring for a moment, and we'll go back. So for the loud snorers, is this something that is easier to treat than the sleep apnea? What's your experience here?
I've found about 80% of snorers have some form of sleep apnea, or they're setting themselves up for that. So I always recommend it, when you have a snorer or you snore, get a sleep study. Let's find out, do you have it or do you not? And that helps us tailor the appliance to what we need.
But I guess the challenge is just getting them in, right? Because men, in particular, were known in the studies to put things off. We only see a doctor when we have to, right? As a last resort. So they're going, I'm just a loud snorer, I'm a loud snorer. So what do you say to these guys that are just self-diagnosing? I'm just a loud snorer, it's part of life.
Or the most common one is, I only snore when I'm tired, or I only snore when I've had a drink or two, and that's just not true.
So what do you tell them, like right now, as a warning?
This affects your body. This affects the rest of your health. It can affect how you function in your day-to-day life. It sets you up for cardiac disease, stroke, diabetes. Latest studies out of Sweden show that this is related. This can have some relation to Alzheimer's. It can affect your libido. There's so much. It's not just, oh, I snore and that's it. This is connected to the rest of your body, and you have to address it.
Now, do you have stories of people that were sleeping in two separate rooms and now they're back?
All the time. All the time.
Do they tell you or the spouse tells you?
They both tell us, and it's a joke in my office. It's like, let's get you back into the bedroom. And I tell everybody, we need to get back to a normal. We have to get back to being a family, to actually getting folks back into the bedroom. And as simple as the oral appliance, that's going to help with your snoring.
Okay, take me through the process. Okay, so somebody's watching this, they go in, it's a free consultation?
Yes.
Okay, they meet with you, what happens?
When they come in, we sit down and talk about what's going on. First thing, we go over the medical history, what their symptoms are, why they're here. And like I said, we have two types of people that mainly come in. They snore, do not know that they have sleep apnea, or they're ones that know they have sleep apnea, have been diagnosed, have a CPAP, just cannot use it. So for the first group that comes in and are unaware of what's going on with them, it's as simple as sending them to the sleep lab to get that sleep study, or if that's something that they do not want to do, we have the home sleep unit we can set them up with, very easy to use. They use it overnight, bring it back in, we run reports, send it to my sleep MD, and get that process going. And once we have the report come in, we have the patient come in, I sit down with them and go over what this means. This is why you're tired. You're not getting oxygen. This is what your oxygen levels were. You're only sleeping, truly sleeping, so many minutes in the night.
Like 2 hours the whole night. They're laying in bed 9 hours.
And the quality sleep that they need is maybe 2 hours. Yes, yes. And that.
What do they say to that?
They're
It must
amazed.
be surprising, right?
They are amazed. They are amazed. It's like, really? This is all? And then the light bulb goes off. You see that moment. It's like, no wonder I feel the way I do. No wonder I'm sick all the time, or no wonder I'm grouchy all the time. Just, it's their light bulb moment right there.
Okay.
And that leads us into, okay, which way do we need to head? What appliance can help them? What settings do I need to set it at before we start the process for the
Now, what about
appliance?
dental work? Some people need dental work?
They could, and there's, I've heard where some places want to build up your bite to kind of get to a point where we can move ahead with this. There's different things that we can do. With the appliances, what I love is if you need work at a certain point, we can work around it. You don't always need to spend a ton of money. to get to this. And we talked about how medical insurance will help you as well.
So medical insurance, they just bring their medical card when they're there?
We check on benefits, and for the most part, we have a very good idea of what it's going to cost them and what's going to be covered.
What other diagnostic tools do you have? I mean, can you examine the patient or look at a CT or what? Because I know you're big on technology in your practice. Can you also visually see that there's an obstruction?
We can sometimes, but nothing functions like the sleep study to give us the perfect idea of what is going on. That will actually measure heart rate. That will actually measure oxygen levels. It measures how many times they're waking up. It measures their pulse. It measures what position they're sleeping in. The data that I get out of that sleep study is priceless. So no matter what other tools we use for diagnosis, this comes back to what I know gives me real-time results. And this is what I'm going to focus on for the diagnosis and treatment, and to actually know if what we're using and doing is helping the patient.
Like anything else, is it earlier treatment is better? Like catching it
always,
early?
Always, absolutely. Why would I want to treat something that's severe when I can address it when it's mild?
But it's hard to get people to do it early, right?
Yes, because everybody thinks they just snore or they're just tired, and that's not it. The bottom line is your body is telling you something. It's sending you a message. It's telling you, I can't breathe, I need oxygen. And it's your job to give your brain that oxygen. Because who wants to wake up feeling tired and grumpy? I don't.
So if you wake up tired, chances are you didn't sleep.
Oh, yes.
It seems like an obvious one.
Oh, yes. Oh, yes. Who likes waking up with a headache? A headache, it means that your brain is oxygen deprived. What more can your body tell you?
So skinny men don't get this?
That's not true.
Oh, really?
I have a patient, gorgeous girl, 22 years old. She had a little one and always thought it was being a new mom that caused her to be tired. Okay. But she was smart enough to listen to her body. She must have weighed maybe 100 pounds. And we tested her, sure enough, she was moderate. She chose to have the appliance, and she's still as gorgeous as ever, but she's also more rested and she has more time with her baby. So it's story after story where we hear all these people who come in and they're just more optimistic. They're going through life more productive. They're feeling so much better, more quality time with their families, their kids. They're spending more time feeling better about themselves, working out, eating healthier. What more can we ask for?
So I know guys, I have two boys, and I was on a school trip, and there was a guy that, we're all sleeping in these cabins, and this is the loudest guy. He had to sleep outside.
And you still heard him, right?
Hear him. And I always wonder, why won't guys like this do something about it? It's just like a stubborn,
it is,
idea. They just don't do it.
It baffles me.
But I didn't ask him, so maybe he has tried something.
Maybe he has a CPAP and can use it. I don't know. I give people the benefit of doubt. But like you said, I also find that people resist it, and I don't understand why, when they can feel so much better. They can feel so much better about themselves. Just the quality of life improves by something as simple as this. We've all worn mouth guards, right? Growing up, playing sports, and that's what this feels like, only better. It's custom made to you, so light, so flexible, you barely feel like you have anything in your mouth when you're sleeping with that. And it just changes your life. It really does.
So, talking about kids again, because you said earlier that a 7-year-old little girl had it. So basically, if you hear the obvious symptom of your children sleeping and making a lot of noises, like snoring or whatever, then you should get them checked.
You should, yeah.
Because kids shouldn't be making noises, right?
They should not. And then we also see kids that grind their teeth. And there could be a variety of reasons. Kids are not miniature adults, even though we like to believe they are. Their bodies are different. Their bodies are still growing. Never hurts to get it checked out. Be it with the pediatrician, be it with the dentist. There's so much that your dentist notices when they're looking at the kids.
So medical doctors will watch this show. They'll stumble onto it. And if you're a medical doctor, especially a general practitioner, you're going to meet a lot of people that have sleep apnea possibly. What do you want them to know about what you're doing as a dentist to treat this? It's
all about team. At the end of the day, they care about their patients, we care about our patients. And like I said earlier, I work with sleep MDs, with board certified ENTs, because for any doctor, the reason we're doing this is to help people. Our goal is to help people be healthier, be it with the CPAP, be it with the oral appliance. Our goal is to make sure our patients are healthy. So it's all about a team effort. If I have a patient that I know will probably use their CPAP, I'm going to guide them into it. But unfortunately, the reality is most folks don't, which is why we are here to make sure that the patients are able to breathe, they're able to get the oxygen they need, they're able to live healthy lives. And it comes down to just being a team.
Now back to the CPAP for a moment. So you pretty much, on most of the devices, have to sleep on your back the entire night.
Yes.
And that's tough for most people to do.
It is.
Now with your appliance, you can sleep on your side, it doesn't matter.
It does not matter because it's your jaw that's being repositioned. It doesn't have to hold anything on your face in a certain position. Once it's in there, it holds your jaw where it needs to be. So it doesn't matter if you're on your back, on your left side, your right side, it doesn't matter
So
at
there's a
all.
lot of manufacturers probably in your business that make these devices. You've been doing this a long time. Mm-hmm. So do you feel like you picked the most comfortable one? The
Yes.
most effective one?
Yes, absolutely. Like I said, whenever I come across a device that I think is going to benefit my patients or I like what it does, I usually like to have it made for myself because I want to be able to put it in.
Did you try sleeping with one?
Yes, they're super comfortable.
Okay.
They are. And I want to make sure they're not going to poke my gums or irritate my cheek or any such thing at all. And appliances have come a long way. They're so much lighter, more comfortable, more streamlined, flexible. It's just amazing.
Okay, good. And you sleep better. So it's
Yeah,
like,
yeah.
you know there's these commercials where the guys get their hair and they're hiking and canoeing and running and dating and kissing and all these things. Same could be said for this.
Yes,
When you
except
feel
it
good,
will not grow your new hair.
Yeah,
But,
but
it will help you sleep better.
when you feel good,
Yes.
you wake up good, you do more things in life.
Absolutely. You're just more, you're a nicer person to be around. Let me put it that way. You're just in a better mood.
Okay.
You feel better.
When you hear, like you're on a consult, and we're like a minute left, and you hear their hard luck story, like you could probably visually see how down and out they are. Do you ever get excited? Like you think, boy, this is going to be good?
Yes. Yes, I know that's going to be one of the stories where they're going to come back and tell me, can I shoot you a video testimonial so we can share with other people who may not know what's going on? And I'm like, yes, you don't know how many people could benefit from this. They're the ones that'll come in and they're just smiling.
Okay, good. Well, Dr. Dassani, pleasure having you back on the program.
Thank you.
If they want to make an appointment, they get to see you.
Yes.
And the consultation's free.
Yes.
And medical insurance, you have somebody dedicated in your office
Yes.
that will
We
get every
do.
penny out of their medical insurance if
Yes.
possible. All right, thanks again.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.